Millions of Americans may already have kidney damage without knowing it. And by the time most people finally discover the truth, the damage may already be permanent. The terrifying part is that kidney disease rarely begins with a dramatic collapse. No flashing warning lights, no sudden unbearable pain. For many people, it begins with something so ordinary they barely notice it at all. Feeling tired, waking up at night to use the bathroom, a little swelling in the ankles, a strange heaviness in the body. Symptoms almost everyone blames on stress, aging, poor sleep, or working too hard. But tonight, there is something you need to understand before we go any further. Your kidneys can lose a massive amount of function before obvious symptoms finally appear, which means someone can look healthy, sound healthy, live a completely normal life, while a silent disease quietly progresses inside their body for years. And if you have parents over 40, if you have diabetes or high blood pressure, or if you have been ignoring strange symptoms yourself lately, stay with me tonight. Because one small warning sign you dismiss today could become the diagnosis that changes your life tomorrow. The man looked completely normal. That was the terrifying part. Every morning, he woke up at 6:30 sharp in a quiet suburb outside Chicago. He made coffee, black. No sugar. He packed his lunch into the same faded blue cooler he had carried to work for almost 15 years. He kissed his wife goodbye, rubbed his lower back for a second as he stepped outside, and drove through traffic thinking about bills, deadlines, and whether his favorite football team would finally make the playoffs this year. Nothing about him looked sick. Not really. Sure, he had been more tired lately. But who wasn't? He was 52 years old. He worked long hours. He slept less than he used to. Sometimes he woke up 2 or 3 times a night to use the bathroom. Sometimes his ankles looked slightly swollen by evening. Sometimes he felt a strange fog in his head, like his energy had quietly drained away while he slept. But he blamed age, stress, too much coffee, too little sleep. Like millions of other Americans, he assumed his body was simply slowing down. And so he kept going, through the fatigue, through the brain fog, through the restless nights. Because modern life teaches people to normalize exhaustion. Parents survive on caffeine and 4 or 5 hours of sleep. Office workers stare at screens all day while ignoring headaches and burnout. Truck drivers spend endless hours sitting behind the wheel, eating gas station food, and pushing through exhaustion because bills still need to be paid. Construction workers live with chronic aches so long that pain stops feeling unusual. Retirees assume every new symptom is simply part of getting older. And slowly, something dangerous begins happening. The line between normal discomfort and warning signs starts to disappear. That blurred line is where kidney disease often hides. Quietly, patiently, for then one afternoon, after weeks of worsening exhaustion, the man finally scheduled a doctor's appointment. Blood tests were ordered, urine tests followed. A few days later, he sat silently inside a small examination room while the physician stared at the computer screen for a long moment before finally speaking. Your kidneys are functioning at less than 20%. Less than 20%. The words barely sounded real, because just 6 months earlier, he still believed he was healthy. He would later discover something that haunted him even more than the diagnosis itself. His body had been warning him for years. He just did not recognize the signals. And that is exactly why kidney disease has become one of the most dangerous silent health crises in America today. Not because it moves quickly, but because it moves quietly. Tonight, we are going to uncover the warning signs most people ignore until it is too late. The subtle body changes, the strange symptoms, the silent clues many people dismiss as stress, aging, poor sleep, burnout, or simply working too hard. But underneath those ordinary explanations, something far more dangerous may already be unfolding. And there are 3 questions that will quietly follow us throughout this entire journey tonight. First, why do so many people discover kidney disease only after permanent damage has already occurred? Second, what warning signs does the body send long before most patients realize anything is wrong? And third, could some of the symptoms you experience every single day already be connected to your kidneys without you even realizing it? Because the truth is, the body often whispers before it screams, and most people never hear the whispers. Chronic kidney disease affects millions of Americans. But one of the most disturbing realities is that many people living with kidney damage do not know they have it. Not until the disease has already advanced. Not until kidney function becomes dangerously weak. Not until treatment options become smaller, more exhausting, and far more expensive. That is why doctors sometimes call kidney disease the silent killer. Not because it strikes suddenly, but because it develops invisibly. Unlike a heart attack, kidney disease often does not announce itself with dramatic pain. It usually progresses slowly over many years, quietly damaging the body while daily life continues as normal. You go to work, you answer emails, you sit in traffic, you attend birthdays, you watch football on Sunday, you scroll through your phone late at night. And all the while, deep inside the body, the kidneys may already be struggling to keep up. The frightening part is that the human body is incredibly good at adapting. When some parts of the kidneys become damaged, the remaining healthy areas work harder to compensate. For a long time, this hidden compensation creates the illusion that everything is fine. Which raises a terrifying question. How much damage can happen before symptoms finally become impossible to ignore? For some people, the answer is far more than they ever imagined. Many patients diagnosed with chronic kidney disease later say the exact same thing. I never saw it coming. They remember feeling tired. They remember waking up at night. They remember swelling in their feet. But none of it felt serious enough to trigger alarm, because the symptoms seemed ordinary. And ordinary symptoms are incredibly easy to ignore, especially in modern American life where exhaustion has become almost a cultural identity. People brag about surviving on little sleep, living on caffeine, working nonstop, ignoring stress, pushing through pain, and somewhere tonight, there is probably someone listening to this who is brushing off a symptom that may already be connected to declining kidney function. A person blaming constant fatigue on burnout. A woman assuming swollen ankles come from standing too long. A man waking up 3 times every night to urinate, convinced it is simply age. Someone becoming short of breath while climbing stairs, blaming poor fitness. And perhaps the most dangerous part of all, many of these people still look completely healthy from the outside. That illusion delays testing, delays diagnosis, delays treatment. And in kidney disease, time matters, because once severe kidney damage occurs, it often cannot be fully reversed. The kidneys are not organs most people think about every day. You can hear your breathing, feel your heartbeat, notice pain in your joints. But kidneys work silently in the background every minute of every day, performing some of the most important survival functions in the human body without asking for attention, until they begin to fail. And when they do, the effects spread far beyond the kidneys themselves. The blood, the heart, the lungs, the bones, the brain, the entire body begins feeling the consequences. But here is something many people still do not realize. Long before kidney disease reaches its final stages, the body usually sends signals, subtle ones, easy to dismiss, easy to misunderstand. Sometimes the first clue appears in the bathroom. Sometimes it appears in the mirror. Sometimes it appears in the middle of the night while struggling to breathe. And sometimes it appears as a symptom so common that millions of Americans experience it every single day without ever suspecting their kidneys could be involved. We will get to that symptom soon. But first, to understand why kidney disease becomes so dangerous, we need to understand what these 2 silent organs are actually doing inside your body every minute of every day. Because once you realize how much your kidneys truly control, the warning signs suddenly become impossible to ignore. Most people spend almost their entire lives without ever thinking about their kidneys. Not really. You think about your heart when your chest pounds. You think about your lungs when breathing becomes difficult. You think about your stomach when pain strikes after a heavy meal. But the kidneys work in silence. No dramatic warning sounds, no sharp alarms, no constant reminders that they are there. And yet, every minute of every single day, these 2 small organs are performing one of the most important survival jobs inside the human body. Right now, at this very moment, your kidneys are working. Even if you are lying in bed, even if you're driving home from work, even if you are listening to this late at night with the lights off and the rest of the house asleep, your kidneys never truly stop. And perhaps the most astonishing part is their size. Each kidney is only about the size of a human fist. Small, compact, almost modest looking. They sit quietly near your lower back, tucked beneath the rib cage on either side of the spine, protected deep inside the body where most people never notice them at all. But despite their relatively small size, they process an enormous amount of blood every single day. Hour after hour, day after day, year after year. Like two highly advanced biological filtration systems operating 24 hours a day without vacation, without weekends, and without rest. Imagine a massive water treatment plant serving an entire city. Pipes flowing endlessly, filters removing dangerous waste, chemical balances being monitored every second, emergency systems adjusting pressure levels constantly to keep everything stable. Now imagine shrinking that entire system down into two fist-sized organs. That is essentially what your kidneys are doing inside your body. And here's where things become truly fascinating. Most people think the kidneys only make urine. That is only a small fraction of their job. In reality, the kidneys function more like the body's hidden command center for survival. They constantly analyze the blood flowing through your body. What should stay? What should leave? What is too high? What is too low? What could become dangerous if balance is lost? Every moment, the kidneys make countless microscopic decisions designed to keep you alive. They remove waste products created by normal metabolism. They filter out toxins. They help eliminate excess chemicals. They regulate fluid levels so your cells neither dry out nor drown in excess water. And they do all of this with astonishing precision. Too much fluid in the body can strain the heart and lungs. Too little fluid can damage tissues and reduce circulation. Your kidneys sit in the middle of that balancing act every second, quietly adjusting, quietly correcting, quietly protecting you. But there is another layer to this story that many people never hear about. Your kidneys are deeply connected to your blood pressure. In fact, they play a major role in controlling it. When blood pressure drops too low, the kidneys help trigger mechanisms that raise it. When pressure rises too high, the kidneys attempt to reduce stress on the body by adjusting fluid and sodium balance. This means the relationship between high blood pressure and kidney disease becomes dangerously circular. High blood pressure damages the kidneys. Damaged kidneys worsen blood pressure. And over time, that cycle can quietly accelerate. Many people never realize this is happening until both systems have already been compromised. And then there is another hidden role the kidneys perform, one that surprises many people the first time they hear it. Your kidneys help create red blood cells. That's right. Deep inside the kidneys, specialized cells produce signals that tell the body to make red blood cells in the bone marrow. Why does that matter? Because red blood cells carry oxygen throughout the body. When kidney function declines, this process weakens. Fewer red blood cells are produced. Oxygen delivery becomes less efficient, and suddenly symptoms begin appearing that seem completely unrelated to the kidneys. Fatigue, weakness, brain fog, shortness of breath, difficulty concentrating. Many people blame stress, or aging, or lack of sleep, never realizing the problem may actually begin deep inside the kidneys themselves. And the kidneys do not stop there. They also help regulate essential minerals like sodium, potassium, calcium, and phosphorus. These minerals affect nearly everything in the body: muscle contractions, nerve signals, heartbeat rhythms, fluid balance, bone strength. One small imbalance can trigger chain reactions throughout the entire system. This is why advanced kidney disease can eventually affect the heart, muscles, brain, nerves, and bones all at the same time. The kidneys are not isolated organs. They are deeply connected to the body's entire internal stability, almost like silent conductors directing a biological orchestra. And perhaps one of the most overlooked functions of all is their role in protecting bone health. Healthy kidneys help activate vitamin D, allowing the body to properly absorb calcium. Without this process, bones can gradually weaken over time, which means kidney disease is not only about urine or filtration. It can slowly influence the structural strength of the human body itself. That realization changes how we think about these organs, because suddenly the kidneys are no longer just filters. They become guardians of balance, guardians of circulation, guardians of oxygen, guardians of chemistry, guardians of survival. And the frightening part is that most people never notice how important their kidneys are until those systems begin falling apart. Think about how much pressure modern lifestyles place on these organs every day. Highly processed food, excess sodium, dehydration, alcohol, chronic stress, lack of sleep, obesity, diabetes, high blood pressure, painkillers used week after week, energy drinks, fast food, sugary beverages. The kidneys are forced to process all of it, relentlessly, silently, year after year. And because the kidneys are so resilient, they often continue functioning even while damage slowly accumulates in the background. That resilience becomes both a gift and a danger. A gift because the body can survive tremendous stress for a long time. A danger because symptoms may stay hidden while the damage quietly progresses. This brings us back to one of the biggest mysteries surrounding kidney disease. Why do so many people feel mostly okay until the condition becomes severe? The answer lies in the kidney's extraordinary ability to compensate. Even when parts of the kidneys become damaged, remaining healthy tissue works harder to maintain balance. For a while, the body adapts. It covers the problem. It hides the crisis. But compensation has limits. Eventually, the system begins struggling to keep up. Waste products slowly accumulate. Fluid balance becomes unstable. Blood pressure rises. Oxygen delivery weakens. Mineral levels shift. And subtle symptoms begin appearing across the body, like quiet warning lights on a dashboard. The terrifying part is that many of these warning lights seem harmless at first. A little swelling, a little fatigue, a little trouble sleeping, a little shortness of breath. Easy to dismiss, easy to rationalize, easy to ignore, especially when life is already busy. And there's another reason kidney disease becomes so dangerous. Unlike some medical conditions, kidney damage often develops without pain. No dramatic injury, no sudden collapse, no sharp signal demanding immediate attention. Years can pass while damage slowly grows in silence. That silence is what makes kidney disease so deceptive. You can survive with many weakened organs for a while, but when the kidneys fail, toxins begin building silently inside your body. And once enough damage occurs, reversing it becomes incredibly difficult, which raises an unsettling question. If kidney disease can remain hidden for years, what are the first warning signs people tend to overlook? Because in many cases, the body does try to warn us. Not loudly, not dramatically, but quietly. Through symptoms most people would never suspect are connected to the kidneys at all. And one of the earliest warning signs is something millions of Americans battle every single day: constant exhaustion that never fully goes away. There is something deeply unsettling about diseases that arrive quietly, not because they move fast, but because they move slowly enough for you to keep living normally while damage accumulates in the background. You continue going to work. You continue making plans for next year. You continue telling yourself you are simply tired. Meanwhile, something inside the body may already be changing in ways you cannot feel yet. And kidney disease is one of the most dangerous examples of that silent progression. To understand why, we first need to understand that not all kidney disease happens the same way. Some forms strike suddenly. Others unfold so slowly that people adapt to the symptoms without realizing it. Doctors generally separate kidney failure into two major categories: acute kidney injury and chronic kidney disease. Acute kidney injury happens fast, sometimes within hours, sometimes within days. A severe infection, major blood loss, a dangerous reaction to medication, extreme dehydration, a sudden blockage. In these situations, the kidneys may abruptly lose their ability to filter waste properly. The symptoms can become dramatic very quickly. Confusion, swelling, difficulty breathing, dangerously abnormal blood chemistry. But there is an important difference. In some cases, acute kidney injury can be reversed if doctors identify the problem early and treat it aggressively. The kidneys may recover partially or sometimes almost completely. Chronic kidney disease is very different. It does not usually arrive like a storm. It arrives like erosion, slow, silent, patient. Year after year, tiny units inside the kidneys gradually become damaged. Little by little, the body loses filtering capacity. At first, the remaining healthy tissue works harder to compensate. And this is where the danger truly begins, because the kidneys are remarkably adaptive. Even when part of the system is injured, healthy areas increase their workload to maintain balance. For a long time, this creates the illusion that nothing is wrong. Blood pressure may rise slightly, energy levels may decline slightly, Sleep may worsen slightly, a little swelling, a little fatigue, a little brain fog. But life still functions. So people continue ignoring the signs. That compensation mechanism is one of the biggest reasons chronic kidney disease becomes so devastating. The body hides the crisis from you, until one day, it can't anymore. Imagine driving a car with an engine slowly failing deep inside. At first, the vehicle still moves, the dashboard lights stay dark, the engine strains quietly behind the scenes, and because the car still runs, you assume everything is fine. But damage continues building mile after mile. Then eventually, the system reaches a breaking point. Kidney disease often follows a similar path. Many patients later discover that damage had been progressing for years before diagnosis. Years. Not weeks, not months, years. That realization can be psychologically devastating because people replay the past in their minds, the fatigue they ignored, the swelling they brushed aside, the nighttime urination they joked about, the shortness of breath they blamed on age. Suddenly, symptoms that once seemed harmless take on an entirely different meaning. And perhaps the most frightening part is that chronic kidney disease rarely causes pain in its early stages. No dramatic alarm, no immediate collapse, no sharp warning that forces people into the emergency room. The disease quietly advances while life continues around it. Birthdays, vacations, holidays, football games, work meetings, family dinners, all while kidney function slowly declines in silence. This is why so many patients say the same haunting sentence after diagnosis. I never saw it coming. Not because they ignored obvious suffering, but because the symptoms blended into normal life. Modern American life already leaves millions of people exhausted. People are overworked, underslept, stressed, dehydrated, dependent on caffeine, surrounded by highly processed food. Constant fatigue no longer feels unusual, which means one of the earliest signs of kidney dysfunction becomes almost invisible. And there is another layer to this danger. As kidney disease progresses, waste products begin accumulating inside the bloodstream. Toxins that healthy kidneys would normally remove remain trapped inside the body. Fluid balance becomes unstable. Mineral levels shift. Blood pressure becomes harder to control. The heart experiences greater strain. The lungs may begin retaining fluid. The bones weaken. The brain becomes foggy. The entire internal environment of the body slowly changes. But because these changes happen gradually, people adapt psychologically. Humans are incredibly good at normalizing slow decline. If exhaustion appears suddenly overnight, it feels alarming. But if energy fades little by little over 5 years, many people barely notice how much has changed. They simply adjust their lives around it. More coffee, more naps, less activity, avoiding stairs, going to bed earlier, skipping exercise, telling themselves, "I'm just getting older." Meanwhile, kidney function may already be dangerously reduced. And eventually, for some patients, the disease reaches a terrifying stage where the kidneys can no longer support life on their own. This is the point where dialysis enters the picture. For many people, dialysis is not just a medical procedure, it is a complete transformation of daily existence. Imagine, depending on a machine to perform the filtration work your kidneys can no longer handle. Multiple times every week, hours at a time, sitting in a clinic while blood cycles through tubes and artificial filters. The process can leave patients exhausted, drained, nauseated, emotionally overwhelmed. Schedules revolve around treatment, travel becomes difficult, dietary restrictions intensify, fluid intake must often be carefully limited. Many patients describe dialysis not as living normally, but as surviving between treatments. And the emotional weight can be enormous. Some patients mourn the life they once had, the freedom, the spontaneity, the physical energy. Others struggle with depression, anxiety, or fear about the future. Families change their routines to accommodate treatment schedules. Financial stress often grows. Medical appointments multiply. And many patients think back to the years before diagnosis, wondering whether earlier intervention could have changed the outcome. That question lingers heavily, because in many cases, chronic kidney disease progresses slowly enough that early detection truly matters, which raises another deeply uncomfortable possibility. How many people right now are already in the early stages without knowing it? Some estimates suggest millions of Americans may have reduced kidney function while remaining completely unaware. No diagnosis, no treatment, no lifestyle changes, No warning strong enough to interrupt daily life. And this is where the psychology of kidney disease becomes especially dangerous. People often fear diseases that kill quickly, heart attacks, strokes, cancer. But diseases that slowly erode health over many years can be equally terrifying in a different way, because they quietly steal normality before anyone realizes what is happening. A person slowly loses energy, sleep quality declines, concentration weakens, swelling appears, breathing changes, nighttime urination increases. And instead of feeling like a single disease, it feels like life itself becoming heavier. That subtlety delays action, and delayed action allows more damage to accumulate. Which brings us back to the three questions quietly unfolding beneath everything we have discussed tonight. Why does kidney disease stay hidden for so long? What symptoms appear before most people realize something is wrong? And perhaps most importantly, could your body already be trying to warn you right now? Because despite its silence, kidney disease often does leave clues. Small ones, strange ones, easy to dismiss ones, the kind of symptoms people blame on stress, age, poor sleep, or overwork. But once you understand how the kidneys affect nearly every system in the body, those subtle signals begin to look very different. And one of the earliest warning signs is this something millions of Americans fight every day without ever suspecting their kidneys may be involved. An exhaustion so persistent, so heavy, that even a full night of sleep never truly seems to fix it. At first, it does not feel dangerous at all. It feels ordinary. That is what makes it so easy to ignore. You wake up in the morning already tired, not exhausted in a dramatic way, just heavy. Like your body never fully recharged during the night. You drag yourself toward the coffee machine. You tell yourself you stayed up too late. Maybe you worked too much. Maybe stress is catching up to you. Maybe this is simply what middle age feels like. So you keep going, because that is what most people do. You push through. You answer emails. You drive the kids to school, you sit through meetings, you survive the afternoon crash with caffeine, sugar, or energy drinks. And when evening finally comes, you collapse into bed believing tomorrow will feel better. But tomorrow feels exactly the same, and then the next day does too. And slowly, almost invisibly, fatigue becomes your normal state of existence. This kind of exhaustion is one of the most common early warning signs of chronic kidney disease, and also one of the most misunderstood. Because fatigue is everywhere in modern American life. People are overwhelmed, overstimulated, underslept, burned out. Millions of people wake up tired every single day. So when kidney-related fatigue begins developing, it blends perfectly into the background noise of modern living. That is why so many people never recognize it as a warning sign. The exhaustion does not feel dramatic enough. It feels explainable. And the human mind loves explanations that feel comfortable. Stress, work, children, aging, poor sleep, too much responsibility, not enough exercise. People blame everything except the possibility that something inside the body may already be struggling. But kidney-related fatigue is different in subtle ways. It lingers, it deepens, it follows people even after rest. Some patients describe it as feeling drained from the inside. Others say it feels like carrying invisible weight throughout the day. Simple tasks become strangely difficult. Concentration slips, mental sharpness fades, words become harder to recall. Afternoons feel unbearable. Some people begin needing naps they never used to need. Others stop participating in activities they once enjoyed because they simply do not have the energy anymore. And here is where the story becomes more complicated. Because this fatigue is not only psychological, it is deeply physical. Healthy kidneys help regulate the production of red blood cells by releasing signals that tell the bone marrow to create them. Red blood cells carry oxygen throughout the body. When kidney function declines, this signaling process weakens. Fewer red blood cells are produced, less oxygen reaches tissues, muscles tire more easily, the brain functions less efficiently. Energy levels begin collapsing slowly over time. This condition is often called anemia. And for many patients with chronic kidney disease, it becomes one of the earliest invisible symptoms. Imagine trying to power an entire city while gradually cutting off its oxygen supply. Lights still function, but dimly. Systems still operate, but inefficiently. Everything becomes slower, heavier, more difficult. That is what reduced oxygen delivery can feel like inside the human body. And because the change happens gradually, people adapt to it without realizing how abnormal their lives have become. A person who once exercised regularly stops going to the gym. A parent who once had patience now feels constantly irritable and mentally exhausted. An office worker struggles to focus during meetings and assumes they are simply burned out. The body adjusts, the mind rationalizes, and the disease continues progressing quietly underneath. There was a woman in Phoenix who described her experience this way. At first, she thought she was just overwhelmed. She worked in a corporate office managing insurance claims, spending almost 10 hours a day staring at dual computer screens under fluorescent lights. Her mornings started with coffee, then another coffee by late morning, then an energy drink after lunch just to survive the afternoon. By the time she got home, she barely had enough energy to cook dinner. She stopped going for evening walks, stopped meeting friends on weekends, stopped doing many of the small things that once made her feel alive. But she never considered kidney disease. Why would she? She was busy, stressed, middle-aged, like millions of other Americans. And besides, exhaustion had become so normalized in her environment that everyone around her looked tired too. Coworkers joked about burnout constantly. People bragged about surviving on 4 hours of sleep. Fatigue became part of workplace culture. So she kept pushing forward, month after month, until one morning, she became dizzy walking from the parking garage to the office elevator. That moment frightened her enough to finally schedule an appointment. Blood work revealed severe kidney dysfunction. She later said something many patients say after diagnosis: "I thought I was just tired." That sentence carries enormous weight, because hidden inside it is one of the greatest dangers of chronic kidney disease. Its symptoms mimic ordinary life. And ordinary life in America has become incredibly exhausting. Long commutes, financial stress, constant digital stimulation, poor sleep quality, ultra-processed food, sedentary jobs, emotional overload. Many people feel physically depleted before disease even enters the picture, which creates the perfect camouflage for kidney-related fatigue. But there are often subtle clues that separate ordinary tiredness from something more concerning. The fatigue persists even after rest. Mental clarity declines, physical stamina decreases noticeably, motivation disappears, the body feels strangely weak. Some people describe climbing stairs and suddenly realizing their legs feel unusually heavy. Others notice they become winded performing tasks that once felt easy. And some experience what doctors often call brain fog, a frustrating sense of mental cloudiness, difficulty concentrating, trouble remembering details, losing track of conversations, reading the same sentence repeatedly because focus keeps drifting away. Again, these symptoms rarely feel dramatic enough to trigger alarm. People assume they are stressed, distracted, overworked, or simply aging. But underneath those assumptions, oxygen delivery may already be declining because damaged kidneys are no longer supporting healthy red blood cell production. And there is another reason this symptom becomes psychologically dangerous. Fatigue slowly reshapes behavior. People move less, exercise less, cook less, socialize less. The body becomes more sedentary. Weight gain becomes easier. Blood pressure may worsen. Blood sugar control may deteriorate. All of these factors can place even greater strain on already vulnerable kidneys. In other words, fatigue does not only reflect the disease, it can quietly accelerate it. This creates a vicious cycle. Reduced kidney function causes exhaustion. Exhaustion worsens lifestyle habits. Worsening habits place more stress on the kidneys. And the cycle continues silently for years. Meanwhile, many people keep searching for easier explanations. Maybe they need more caffeine. Maybe they need vitamins. Maybe they just need a vacation. And sometimes those assumptions delay diagnosis far longer than they should. Which raises another unsettling question. If one of the earliest signs of kidney dysfunction can feel this ordinary, what other symptoms are people dismissing every day without realizing the danger? Because fatigue is only one piece of the puzzle. The body often sends other signals too, signals that appear in one of the most private and overlooked parts of daily life: the bathroom. Changes in urination may reveal kidney problems long before many people ever receive abnormal blood test results. And what appears there can sometimes tell a story the body has been trying to whisper for years. Most people never really look. They walk into the bathroom half asleep, flush automatically, wash their hands, move on with their day. And yet, hidden in that brief everyday moment may be some of the earliest warning signs that the kidneys are struggling. Have you ever looked into the toilet and immediately flushed without paying attention? Most people have, because urine feels unimportant, routine, forgettable. But your urine is actually one of the clearest windows into what may be happening deep inside your body. Long before severe kidney disease develops, subtle changes often begin appearing there first, and many people ignore them for years. At first, the changes may seem harmless. You start waking up once during the night to urinate, then twice, then maybe 3 times. But instead of feeling alarmed, people usually create comforting explanations. I drank too much water before bed. I'm getting older. My bladder isn't what it used to be. And yes, sometimes those explanations are true. But sometimes they are not. Sometimes the kidneys themselves are beginning to lose their ability to regulate fluid balance properly, and the body is quietly trying to tell you. Frequent urination, especially during the night, can become one of the earliest warning signs of kidney dysfunction. Healthy kidneys carefully filter blood and maintain precise control over fluid balance. When damage develops, that system becomes less efficient. Fluid handling changes, urine patterns shift, and suddenly people find themselves making repeated nighttime trips to the bathroom without understanding why. The dangerous part is how easily this symptom blends into normal aging. Many Americans over the age of 40 already expect some level of nighttime urination. So when it increases gradually, it rarely feels alarming. But kidney disease thrives inside symptoms people normalize. That is one of its greatest advantages. It hides inside ordinary life. There was a man in Texas who later described how this symptom began for him. At first, he woke up once every night around 3 a.m. No big deal. Then it became twice. Then eventually he started planning his evenings around bathroom access. Long road trips became annoying. Movies became interruptions. Sleep became fragmented. But he blamed age. He blamed coffee. He blamed drinking too much iced tea during the day. What he never considered was kidney disease. Because in his mind, kidney failure belonged to hospitals, dialysis centers, severely ill patients, not ordinary people still going to work every morning. Years later, he learned his kidney function had already dropped significantly. And looking back, he realized his body had been sending signals all along. This is one of the unsettling truths about chronic kidney disease. The symptoms often appear quietly enough for people to adapt around them. Instead of asking why something is happening, they simply rearrange life to accommodate it. And nighttime urination is only one possible clue. The appearance of urine itself can also change in ways many people overlook. Healthy urine is usually relatively clear to pale yellow, depending on hydration. But when kidney function becomes impaired, urine may begin appearing darker, sometimes deep yellow, sometimes tea-colored, sometimes unusually concentrated. Other times, blood may appear. Not always dramatic bright red blood, sometimes only a pinkish tint or rust-colored discoloration, or tiny amounts invisible to the eye but detectable through testing. Blood in urine should never be ignored. It does not automatically mean kidney disease, but it always deserves medical attention. Because the body is signaling that something abnormal may be happening somewhere in the urinary system. And then there is one of the most overlooked warning signs of all: foamy urine. Not just ordinary bubbles that disappear quickly. Persistent foam, thick froth, bubbles that linger in the toilet bowl long after flushing. Many people dismiss this completely. They assume the water pressure caused it, or cleaning chemicals, or dehydration. But persistent foamy urine can sometimes indicate protein leaking into the urine. And that matters because healthy kidneys are designed to keep protein inside the bloodstream. Protein is valuable. The body needs it. Normally, the kidneys filter waste while preserving important substances like protein. But when kidney filters become damaged, protein can begin leaking through into the urine. Doctors often call this proteinuria. And in many cases, it becomes one of the earliest measurable signs of kidney damage. Imagine a coffee filter developing tiny tears. Instead of separating liquid properly, important material starts escaping through damaged openings. Something similar can happen inside diseased kidneys. The filtration system loses precision, and once that process begins, the body may already be entering dangerous territory. What makes this symptom psychologically powerful is how visible it can become. If people actually pay attention, but most do not, modern life trains people to rush, to move fast, to ignore subtle signals from the body until symptoms become impossible to overlook. Which raises another disturbing question. How many warning signs do people witness every day without realizing their significance? Because urine changes are not always dramatic. Sometimes the odor changes, a stronger smell, a sharp chemical scent, an unusually foul odor that seems different from normal. Again, there are many possible causes: diet, hydration, infections, medications. But persistent changes deserve attention, especially when combined with fatigue, swelling, or changes in urination frequency. The kidneys are part of an incredibly delicate filtration and waste removal system. When that system weakens, the chemistry of urine often changes too. And here is something many people do not realize. Your urine may reveal kidney problems years before blood tests become severely abnormal. Years. That means the body may be whispering long before it starts screaming, but only if someone is listening. There is a reason doctors often request urine samples during routine exams. Urine can reveal protein leakage, blood, signs of inflammation, abnormal concentration, hidden metabolic problems, early evidence of declining filtration. In some cases, urine changes become one of the first clues that something deeper is wrong. And yet many people avoid testing entirely because they feel mostly fine. That phrase again, mostly fine. Those two words appear constantly in stories of chronic illness. Because severe disease does not always feel severe in the beginning. Sometimes it feels ordinary, manageable, explainable, until suddenly it isn't. And kidney disease is especially dangerous because the body can compensate for dysfunction for an incredibly long time. People continue functioning while damage progresses underneath. They adapt to interrupted sleep. They adapt to fatigue. They adapt to discomfort until adaptation itself becomes part of the trap. A woman in Florida once described how embarrassed she felt discussing her urinary symptoms with her doctor. She thought frequent nighttime urination was simply part of aging after menopause. She delayed bringing it up for nearly 3 years. During that time, she also noticed increasing fatigue and occasional swelling in her feet. But because each symptom seemed mild individually, she never connected them together. Eventually, routine testing revealed chronic kidney disease. Later, she said something heartbreaking. "I thought these were just annoying little problems." That sentence reveals something important. The body rarely sends all warning signs at once. Instead, symptoms often arrive in fragments. A little fatigue, a little swelling, a little sleep disruption, a little change in urine. Individually, they seem harmless. Together, they may form a pattern. And patterns matter, especially when kidney disease is involved. Because once significant kidney function is lost, restoring it becomes far more difficult. This is why awareness matters so much. Not panic, not fear, awareness, paying attention, recognizing that small symptoms may deserve a closer look instead of automatic dismissal. And there is another symptom that often appears alongside changes in urination, one many people notice first thing in the morning while staring into the bathroom mirror: swelling. Subtle at first, easy to overlook, but sometimes it is one of the clearest signs that the kidneys are no longer managing fluid the way they should. Sometimes the body reveals danger in the quietest moments imaginable. Not during a medical emergency, not during a dramatic collapse, but in the soft light of an ordinary morning. You wake up, walk into the bathroom, look in the mirror, and something seems slightly different. Your face looks puffier than usual. Your eyelids seem swollen. Your fingers feel stiff. Maybe your wedding ring suddenly feels tighter. Maybe your socks leave deep marks around your ankles by the end of the day. At first, you barely think about it. Too much salty food last night, not enough sleep, long work hours, hormones, heat, stress. Again, the mind reaches for comforting explanations, and sometimes those explanations are true. But sometimes the swelling is not random at all. Sometimes it is a signal that the kidneys are struggling to control fluid balance inside the body. Healthy kidneys constantly regulate sodium and water levels with extraordinary precision. They decide how much fluid stays, how much leaves, how much sodium the body retains, how much gets excreted. But when kidney function begins declining, that balancing system weakens. Sodium starts accumulating, water follows sodium, and fluid slowly begins collecting in places where it should not remain. That process is called fluid retention, and in many cases, swelling becomes one of the clearest visible signs that something deeper may be wrong. The swelling often appears gradually: feet, ankles, hands, fingers, eyelids, lower legs. Sometimes mild at first, easy to dismiss, but over time, the body may begin holding more and more excess fluid. Shoes feel tighter, rings become harder to remove, faces appear puffier in photographs. People notice they look inflamed or bloated without understanding why. And once again, chronic kidney disease hides behind symptoms that modern life has normalized. Because swelling is incredibly common in America, long hours sitting at desks, long car commutes, obesity, highly processed diets, lack of movement, excess sodium consumption. Many people experience occasional swelling and never think twice about it. But persistent swelling deserves attention, especially when it appears alongside fatigue, changes in urination, or high blood pressure. There was a woman in Chicago who described how she first noticed the symptom while getting ready for work. She reached for her wedding ring one morning and suddenly could not slide it comfortably onto her finger. At first, she laughed about it. She blamed restaurant food from the night before. Then she noticed her eyelids looked swollen every morning. Not dramatically, just enough to seem strange. Over the following months, her ankles began swelling by evening. Again, she rationalized it. Too much sitting, stress, getting older. Meanwhile, her kidneys were already losing function. Years later, she said something haunting. My body was changing right in front of me, and I still convinced myself it was normal. That sentence captures something important about chronic disease. Humans are remarkably skilled at adapting to slow deterioration. When changes happen gradually, the brain absorbs them into ordinary life. People stop questioning symptoms. They simply adjust around them. Looser shoes, stretchier clothing, less activity, more excuses. And the disease keeps progressing silently underneath. What makes kidney-related swelling especially dangerous is that it reflects more than simple water retention. It reflects a filtration system struggling to maintain internal balance. Imagine a city whose drainage system slowly stops functioning properly. Water begins collecting where it should not. Pressure builds. Systems become overloaded. Something similar happens inside the body when the kidneys cannot efficiently remove excess sodium and fluid. And the modern American diet often makes that burden dramatically worse. This is where lifestyle enters the story in a powerful way. The average American diet contains astonishing amounts of sodium. Fast food, frozen meals, packaged snacks, processed meats, pizza, restaurant meals, drive-through culture, even foods that do not taste particularly salty may contain enormous sodium levels hidden inside processing and preservation methods. The kidneys must handle all of it. Every day, meal after meal, year after year. When sodium intake becomes excessive, the body retains more water to maintain chemical balance. That means more fluid volume, more pressure on blood vessels, more strain on the kidneys. And if kidney function is already weakening, the system becomes even more overwhelmed. This creates another vicious cycle. Damaged kidneys struggle to remove sodium and water. Excess sodium and water increase blood pressure. Higher blood pressure damages the kidneys further. The cycle quietly accelerates. Meanwhile, many people continue eating in ways that place enormous stress on the filtration system without realizing it. Supersized fast food meals, processed snacks late at night, sugary beverages, ultra-processed frozen dinners, heavy restaurant portions loaded with sodium. The kidneys absorb the consequences silently. And because symptoms often remain subtle in the beginning, people rarely connect their dietary habits to kidney health until much later. There is also a psychological dimension to swelling that many patients describe. It changes how people feel about their own bodies. The face looks unfamiliar. Hands feel stiff. Legs feel heavy. Some people become self-conscious. Others become frustrated because they cannot explain why they feel swollen despite trying to lose weight or improve their lifestyle. And sometimes, the swelling is worse in the morning, especially around the eyes. This happens because fluid redistributes while lying down during sleep. A person wakes up and sees puffiness in the mirror without realizing the body may already be struggling to regulate fluids properly. For some patients, swelling progresses beyond discomfort. Shoes no longer fit properly. Walking becomes tiring. Skin feels tight. Pressure builds in the legs and feet. And in advanced stages, fluid may even begin affecting the lungs, contributing to breathing difficulties. Again, kidney disease rarely stays isolated to one body system. Everything connects. The kidneys influence circulation, fluid balance, blood pressure, oxygen delivery, heart strain, electrolytes. And once those systems become unstable, symptoms begin spreading throughout the body in ways many people never expect. This is why swelling should never be viewed completely in isolation, especially when it appears alongside other subtle warning signs we have already explored tonight. Persistent fatigue, nighttime urination, foamy urine, mental fog, changes in blood pressure. Together, these symptoms may form a much bigger story, a story the body has been trying to tell quietly for years. And perhaps the most dangerous part is that many people delay medical attention because the swelling itself does not feel painful. Just uncomfortable, annoying, mild. But chronic kidney disease often advances inside symptoms that seem mild until they are no longer mild at all. That delayed recognition becomes one of the greatest reasons so many patients later say, "I wish I had paid attention sooner." Because once kidney function declines significantly, treatment becomes far more difficult. The goal is not fear. It is awareness, understanding that the body whispers before it screams. And swelling is one of those whispers, a visible clue that the filtration system may already be under strain. But for some people, the next warning sign appears in a completely different setting altogether. Not in the mirror, not in the bathroom, but in the middle of the night, while lying in bed trying desperately to breathe normally and stay asleep. For many people, the most frightening symptoms do not happen during the day. They happen in darkness, when the house is quiet, when everyone else is asleep, when the body can no longer hide what is happening beneath the surface. It often begins subtly. A strange feeling of breathlessness climbing stairs, getting winded, carrying groceries, needing a moment to catch your breath after simple activities that never used to feel difficult. Again, most people rationalize it immediately. I'm out of shape. I'm getting older. I need to exercise more. And sometimes that is true, but sometimes the body is struggling for a very different reason. As kidney disease progresses, several dangerous changes begin unfolding inside the body at the same time. Fluid balance becomes unstable, anemia may worsen, oxygen delivery weakens, and together those changes can begin affecting breathing itself. Healthy kidneys help regulate fluid levels carefully, but when they lose efficiency, excess fluid may begin accumulating throughout the body, not only in the legs or face, sometimes in the lungs. That fluid buildup can make breathing feel heavier and more difficult, especially when lying flat at night. At the same time, declining kidney function may reduce red blood cell production, leading to anemia. Fewer red blood cells mean less oxygen traveling through the bloodstream. The heart works harder, the lungs work harder, the body struggles to maintain energy and oxygen balance. And many people first notice this problem not during exercise, but while trying to sleep. There is something deeply terrifying about waking up unable to breathe properly. Some people describe jolting awake around 3 in the morning, suddenly gasping for air, heart pounding, chest tight, mind disoriented. For a few terrifying seconds, the body feels panicked and starved for oxygen. Then the breathing stabilizes, and because the episode passes, many people dismiss it. Maybe it was anxiety, maybe a nightmare, maybe acid reflux, maybe stress. But repeated nighttime breathing disturbances should never be ignored, especially when they occur alongside fatigue, swelling, high blood pressure, or urinary changes. And then there is snoring, one of the most normalized symptoms in modern life. People joke about it constantly. Couples complain about it. Entire industries exist selling products designed to reduce it. But chronic loud snoring, interrupted breathing during sleep, and waking up gasping may sometimes signal sleep apnea. And sleep apnea appears surprisingly often in patients with chronic kidney disease. The relationship between kidney dysfunction and sleep disorders is complex. Fluid shifts inside the body can affect airway stability, oxygen balance changes. Inflammation increases. The nervous system becomes disrupted, and poor sleep itself places additional stress on the cardiovascular system and kidneys. In other words, the cycle feeds itself. Kidney dysfunction contributes to sleep problems. Sleep problems worsen blood pressure and oxygen stress. That stress can further damage the kidneys. Again and again, chronic disease builds interconnected loops inside the body, and many people remain trapped inside those loops for years without understanding what is happening. There was a man in Ohio who described how his symptoms unfolded slowly over time. At first, his wife complained that his snoring had become unbearable. Not ordinary snoring. Violent snoring interrupted by long pauses in breathing. She would lie awake, listening to silence, waiting nervously for him to inhale again. Then suddenly he would gasp loudly and continue breathing. He laughed it off. Everyone joked about it. He bought different pillows, tried nasal strips, ignored it. Meanwhile, during the daytime, he felt increasingly exhausted. He struggled to focus at work, needed naps on weekends, became short of breath climbing stairs. Still, he blamed stress and getting older. Years later, medical testing revealed advanced chronic kidney disease alongside severe sleep apnea and uncontrolled hypertension. Looking back, his wife later said something chilling. It felt like his body was trying to wake him up before something worse happened. That image stays with people because nighttime symptoms feel uniquely vulnerable. In daylight, distractions exist: work, phones, conversations, noise. But at night, symptoms become harder to escape psychologically, especially the sensation of waking up gasping for air. The body interprets oxygen deprivation as danger. Adrenaline surges, heart rate spikes, panic floods the nervous system. Even after breathing returns to normal, many people remain awake afterward, shaken and exhausted. Then morning arrives, and life continues. Coffee replaces sleep, people drag themselves through another workday, and the cycle repeats, night after night, month after month. This is one reason chronic kidney disease can become emotionally draining long before diagnosis ever occurs. The symptoms infiltrate every layer of life: energy, sleep, mental clarity, mood, relationships, physical endurance. And because sleep deprivation affects nearly every system in the body, people often begin spiraling deeper into poor health. More caffeine, more processed food, less exercise, higher blood pressure, worsening inflammation, all while kidney function may already be declining silently underneath. There is another frightening aspect to nighttime breathing problems. Many people do not realize they are happening. Sometimes only a spouse notices, or a family member, or nobody notices at all. A person simply wakes exhausted every morning without understanding why. Some patients describe feeling as though they never truly enter deep restorative sleep anymore. They spend 8 hours in bed, yet wake feeling drained, heavy, mentally foggy, almost poisoned by exhaustion. That sensation is not imaginary. Poor oxygen balance and fragmented sleep can profoundly affect the brain and body. And when kidney disease contributes to that cycle, the consequences may slowly intensify over time. The body becomes trapped in chronic physiological stress. Blood pressure rises, inflammation increases, heart strain grows, kidney damage may accelerate further. Again, the disease hides inside symptoms that millions of people normalize: snoring, poor sleep, daytime exhaustion, shortness of breath. Modern life has made these problems feel ordinary, but ordinary symptoms can still reflect serious disease. That is one of the central fears running quietly underneath everything we have discussed tonight. What if the body has been warning you for years through symptoms that seemed harmless? Because kidney disease rarely arrives dramatically in the beginning. It whispers through discomforts people dismiss every day. And sometimes, those whispers appear in places nobody would ever connect to kidney function at all. The skin, the muscles, the nerves, strange itching, cramping, restless sensations at night. Signals many people mistake for allergies, dehydration, aging, or stress. But underneath those symptoms, the chemistry of the body may already be shifting in dangerous ways. One of the strangest things about chronic kidney disease is how often the warning signs appear far away from the kidneys themselves. Not in the lower back, not in the urinary tract, but in places people would never suspect: the skin, the muscles, the legs, the nerves. At first, the symptoms seem random: an itch that will not go away, a sudden muscle cramp in the middle of the night, a strange tingling sensation in the feet, restless legs that make sleep feel impossible. Most people never connect these experiences to kidney function. Why would they? Dry skin feels ordinary, muscle cramps feel common, tingling feels temporary, But deep underneath those symptoms, the chemistry of the body may already be changing in dangerous ways. Healthy kidneys do far more than filter waste. They help regulate the delicate balance of minerals and electrolytes that every cell in the body depends on. Calcium, phosphorus, potassium, sodium. These substances constantly move through the bloodstream, helping control muscle contractions, nerve signals, heartbeat rhythms, and countless other biological functions. The kidneys help maintain that balance every minute of every day. But when kidney function declines, the balance begins breaking apart. Waste products start accumulating. Minerals shift into dangerous ranges. Toxins linger in the bloodstream instead of leaving the body. And eventually, those invisible chemical disruptions begin producing physical symptoms. Sometimes the first sign is itching. Not ordinary itching from a mosquito bite or dry winter air. A deeper itch, persistent, frustrating, sometimes impossible to satisfy even after scratching. Some patients describe it as a crawling sensation beneath the skin. Others say it becomes worse at night when distractions disappear and the body becomes impossible to ignore. The mechanism behind kidney-related itching is complex, but toxin buildup and mineral imbalance appear to play major roles. When the kidneys cannot efficiently remove waste, substances begin accumulating inside the bloodstream. At the same time, calcium and phosphorus balance may become disrupted. Those changes can affect the skin, nerves, and inflammatory systems in ways that trigger persistent itching. And once again, most people assume harmless explanations first. Dry air, allergies, laundry detergent, dehydration, stress. They buy moisturizers, switch soaps, change diets, take antihistamines. Meanwhile, the kidneys may already be struggling silently underneath. There was a woman in Arizona who said her itching became so severe at night that she kept a hairbrush beside the bed just to scratch her legs through the sheets. She never imagined it could be connected to kidney disease. She thought it was menopause, or dry desert weather, or allergies. Only later, after blood work revealed declining kidney function, did she understand that the symptom had likely been part of a much larger story unfolding inside her body. That realization frightened her, because suddenly, what once seemed like random discomfort now looked like a warning sign she had misunderstood for years. And itching is only one part of the puzzle. Muscle cramps are another symptom many people dismiss without a second thought. Especially nighttime cramps, a sudden violent tightening in the calf, a sharp spasm in the foot, a muscle locking painfully while the body is half asleep. The pain can be intense enough to wake someone instantly from deep sleep. Heart racing, leg rigid, body panicking and confusion. Then slowly, after stretching or massaging the muscle, the spasm releases, and the person lies awake afterward exhausted and frustrated. Again, most people blame dehydration, overexercise, getting older. But kidney dysfunction can also contribute to muscle cramping through electrolyte imbalance. When calcium, phosphorus, sodium, and potassium levels become unstable, muscles may begin firing abnormally. Nerves become more irritable. Muscle contractions become less controlled, and nighttime cramps may appear more frequently. There is something psychologically exhausting about symptoms that interrupt sleep repeatedly. The body never fully rests. People become anxious about bedtime itself. They fear waking up again in pain. That fear creates another cycle. Poor sleep worsens fatigue. Fatigue worsens stress. Stress worsens physical symptoms. And all of it may be happening while kidney disease continues progressing silently in the background. Some patients also experience restless legs, an uncomfortable sensation deep inside the legs that creates an overwhelming urge to move them constantly. It often becomes worse at night. The legs twitch, shift, ache. People toss and turn trying to find relief. Again, this symptom is frequently linked to kidney dysfunction, anemia, nerve irritation, and metabolic imbalance. And once again, most people never connect it to the kidneys. Because the body does not always send logical warnings. It sends fragments, pieces, clues scattered across multiple systems at once. A little itching, a little cramping, a little numbness, a little exhaustion. Individually, each symptom seems explainable. Together, they may form a pattern, and patterns matter, especially with chronic kidney disease. There is also another symptom some patients describe before diagnosis: tingling sensations, pins and needles, numbness in the feet or hands. This may occur because long-term toxin accumulation and metabolic imbalance can begin affecting nerves themselves. The nervous system becomes irritated, signals become distorted, and strange physical sensations emerge that many people struggle to describe clearly. Again, modern life creates perfect camouflage for these symptoms. People sit too long, work at computers, sleep poorly, experience stress, develop circulation problems. So tingling and cramps feel ordinary enough to ignore, but ordinary symptoms can still reflect extraordinary problems beneath the surface. That is one of the central fears running through everything we have explored tonight. The body often whispers long before it screams, and many whispers sound harmless at first. A little itching, a little swelling, a little fatigue, a little poor sleep, a little cramping, until eventually the whispers begin verging into something harder to deny. There was a retired construction worker in Nevada who described waking almost every night with severe leg cramps. At first, he blamed years of physical labor. Then he blamed dehydration. Then he blamed aging. But over time, the cramps became more frequent. At the same time, he noticed worsening fatigue, swelling in his ankles, and increasing nighttime urination. Still, he delayed seeing a doctor. When he finally did, testing revealed advanced chronic kidney disease. Later, he admitted something many patients quietly feel. "I thought all of it was just normal wear and tear." That phrase is powerful, because kidney disease often disguises itself as ordinary aging. People stop expecting their bodies to feel strong after a certain age. They normalize discomfort, normalize exhaustion, normalize poor sleep, normalize strange symptoms, and in doing so, they may miss opportunities for earlier intervention. The frightening reality is that the body can tolerate worsening kidney function for years while these symptoms slowly intensify, which means many people listening tonight may already recognize pieces of themselves in these stories. The exhaustion, the interrupted sleep, the swelling, the strange cramps, the itching that never fully disappears. That does not automatically mean kidney disease, but it does mean the body deserves attention instead of automatic dismissal. Because once significant kidney damage occurs, recovery becomes far more difficult. And perhaps the most overlooked warning sign of all is pain. Not dramatic pain, not the kind people immediately rush to the hospital for, but a quieter ache many Americans experience every single day without realizing it could sometimes be connected to the kidneys at all. Pain changes the way people think. Unlike fatigue, pain demands attention. Unlike swelling, pain interrupts focus. Unlike subtle urine changes, pain feels immediate and personal. And yet, when it comes to kidney disease, even pain can become dangerously misunderstood, especially lower back pain. Because millions of Americans live with back pain every single day. Office workers sit for hours staring at screens. Truck drivers spend entire days behind the wheel. Warehouse workers lift heavy objects repeatedly. Construction workers strain muscles for decades. Obesity places extra pressure on the spine. Sedentary lifestyles weaken core muscles. By middle age, many people almost expect some degree of chronic back discomfort. That expectation becomes the perfect camouflage for something more serious. Now, it is important to say this clearly. Not all back pain means kidney disease. In fact, most back pain has nothing to do with the kidneys at all. Muscle strain is common. Disc problems are common. Joint inflammation is common. Sciatica is common. But there are certain patterns of pain that deserve closer attention, especially when they appear alongside other symptoms we have already explored tonight. Persistent dull aching, pain deeper in the sides or lower back, discomfort near the area beneath the ribs, pain combined with swelling, fatigue, changes in urination, or high blood pressure. Those combinations matter because the kidneys sit near the lower back on both sides of the spine. And while chronic kidney disease often develops without obvious pain, certain kidney-related conditions can produce discomfort that people mistakenly attribute to ordinary musculoskeletal problems. The pain is not always sharp. Sometimes it is vague, a heavy ache, a pressure sensation, a soreness that seems difficult to pinpoint precisely. People stretch, massage the area, buy heating pads, visit chiropractors, switch mattresses, and sometimes those approaches help because many people truly do have muscle-related back pain. But sometimes the body is trying to communicate something deeper. There was a man in Pennsylvania who spent nearly 20 years working warehouse jobs, heavy lifting, long shifts, constant physical strain. So when he began feeling dull pain along his lower back and sides, he ignored it completely. Why wouldn't he? Everyone around him had back pain too. Coworkers complained constantly. Friends joked about getting older. Pain felt normal. Then other symptoms slowly began appearing. Fatigue, swelling in his ankles, frequent nighttime urination. Still, he blamed work. He blamed age. He blamed years of lifting. For almost 3 years, he never considered kidney disease. Eventually, after experiencing worsening exhaustion and shortness of breath, he finally saw a doctor. Testing revealed significant kidney damage. Later, he said something that echoes through countless patient stories. "I thought my body was just worn out." That phrase reveals something deeply important about chronic illness in modern America. People often assume suffering is normal, especially after years of stress, labor, aging, or unhealthy habits. Instead of asking why symptoms are happening, many people simply accept discomfort as part of adult life. And kidney disease quietly benefits from that acceptance. Because its symptoms rarely appear dramatic enough in the beginning to force immediate action, especially pain. Kidney-related discomfort can be incredibly deceptive. Sometimes it appears as side pain, sometimes as pressure beneath the ribs, sometimes as generalized lower back aching. And because musculoskeletal pain is so common, people almost automatically assume harmless explanations first. Again, the danger is not that every ache means kidney disease. The danger is ignoring patterns. Patterns matter. Persistent pain plus urinary changes, persistent pain plus swelling, persistent pain plus exhaustion, persistent pain plus uncontrolled blood pressure. These combinations deserve medical attention instead of endless self-diagnosis. And there is another layer to this story connected to inflammation. Chronic kidney disease is not simply a filtration problem. As kidney function worsens, inflammation throughout the body may increase. The immune system becomes dysregulated. Blood vessels experience stress. Fluid balance changes. Metabolic waste accumulates. The body begins operating in a state of chronic internal strain. That strain can contribute to generalized discomfort, muscle weakness, and worsening physical fatigue. Some patients describe feeling physically older than they actually are. The body becomes heavier. Recovery slows. Pain lingers longer. Energy disappears faster. Again, many people assume this is simply aging, but sometimes the body is struggling under a hidden metabolic burden caused by declining kidney function. Modern American lifestyles often intensify these risks dramatically. Long sitting hours reduce circulation and contribute to obesity and hypertension. Fast food culture drives sodium and sugar intake higher. Chronic stress raises blood pressure. Poor sleep worsens inflammation. Many workers rely heavily on over-the-counter painkillers just to keep functioning through daily aches and injuries. And ironically, some of those medications may place additional stress on the kidneys themselves, especially non-steroidal anti-inflammatory drugs, commonly called NSAIDs. Millions of Americans take ibuprofen regularly without realizing the potential long-term impact excessive use may have on kidney function. Again, these dangers often build slowly, quietly, invisible at first. And this creates one of the most unsettling psychological aspects of chronic kidney disease. The disease often hides inside symptoms people have already learned to tolerate: fatigue, poor sleep, swelling, cramping, back pain. Most adults know these experiences intimately, which means kidney disease rarely feels like an obvious enemy in the beginning. It feels like ordinary life becoming gradually more difficult. That subtlety delays diagnosis for countless people. And delayed diagnosis matters because kidneys can lose enormous amounts of function before symptoms become unmistakably severe. By the time some patients finally seek help, irreversible damage may already exist. This is why awareness matters so much. Not fear, not panic. Awareness. Understanding when symptoms deserve deeper investigation instead of automatic dismissal. Because one symptom alone rarely tells the full story, but multiple symptoms together may reveal something the body has been trying to communicate quietly for years. There is also a dangerous cultural habit many people develop around chronic pain. They stop listening to it, especially hardworking adults, parents, laborers, caregivers, people responsible for everyone else. They learn to push through discomfort automatically. Keep working, keep moving, keep surviving. That survival mentality can become incredibly destructive when serious disease develops silently underneath, because the body may continue functioning long after damage has already begun, and kidney disease often depends on that silence. The silence of adaptation, the silence of rationalization, the silence of symptoms people normalize until the situation becomes impossible to ignore. Which brings us to another deeply important question. Why do some people develop kidney disease while others never do? What factors quietly increase risk year after year? Because although anyone can develop kidney problems, certain conditions and habits dramatically increase the likelihood of chronic kidney damage over time. And many of the biggest risk factors are woven directly into modern American life itself. By the time many people are diagnosed with chronic kidney disease, they ask the same painful question: how did this happen? And often the answer is not one catastrophic moment, not one dramatic illness, not one obvious injury. The answer is years. Years of pressure, years of silent damage, years of habits that seemed ordinary at the time. Because kidney disease is rarely caused by a single event. More often, it develops through slow accumulation, tiny injuries repeating over and over until the kidneys can no longer compensate. And some of the biggest risk factors destroying kidneys today are woven directly into modern American life. The first major risk factor is diabetes, especially type 2 diabetes. High blood sugar damages blood vessels throughout the body, including the tiny filtering structures inside the kidneys. Those filters are incredibly delicate. Imagine forcing thick syrup through microscopic strainers every day for years. Eventually, damage begins accumulating. Scarring develops. Filtering efficiency declines. Protein leaks into the urine. And over time, kidney function may steadily deteriorate. Diabetes has become one of the leading causes of chronic kidney disease in the United States. And what makes it especially dangerous is that blood sugar damage often progresses silently for years before symptoms become obvious. Many people feel relatively normal while microscopic destruction quietly spreads through the kidneys. The second major risk factor is high blood pressure. Hypertension places enormous stress on blood vessels, including the tiny vessels inside the kidneys. Over time, that pressure damages the filtration system itself. And once kidney function begins declining, blood pressure often rises even further. Another vicious cycle begins. High blood pressure damages kidneys. Damaged kidneys worsen blood pressure. The cycle feeds itself year after year. This is one reason doctors often call hypertension a silent killer. Because just like kidney disease, it may cause damage long before noticeable symptoms appear. And millions of Americans walk around every day with uncontrolled blood pressure without realizing the long-term consequences building inside their bodies. Then comes obesity, a condition deeply connected to modern American lifestyles, processed foods, sedentary jobs, stress eating, sleep deprivation, drive-through culture, massive portion sizes. The body was never designed for constant metabolic overload. Obesity increases the risk of diabetes, hypertension, inflammation, sleep apnea, and cardiovascular disease, all of which place additional stress on the kidneys. The heavier the metabolic burden becomes, the harder the kidneys must work to maintain balance, and eventually, chronic strain may begin causing permanent damage. Smoking is another major risk factor many people underestimate. Cigarette smoke damages blood vessels throughout the body. It reduces circulation, increases inflammation, raises blood pressure, and accelerates vascular injury inside the kidneys themselves. Even beyond cancer and lung disease, smoking quietly harms the body's filtration system over time. Then there is alcohol abuse. Many people think only the liver suffers from heavy drinking, but chronic alcohol abuse can contribute to dehydration, high blood pressure, inflammation, and metabolic imbalance, all of which may indirectly damage kidney health. And perhaps one of the most overlooked risks of all is chronic dehydration. Millions of people move through their entire day partially dehydrated. Coffee in the morning, soda during lunch, energy drinks in the afternoon, alcohol at night. Very little actual water. The kidneys depend on adequate blood flow and hydration to function efficiently. When dehydration becomes chronic, kidney stress may gradually increase over time, especially in people already carrying other risk factors. But there is one danger that resonates powerfully across America because it hides inside medicine cabinets everywhere. Painkillers, especially NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen. Countless people rely on these medications daily just to survive modern life. Back pain, headaches, sports injuries, joint pain, work-related strain. People take them casually because they are available over the counter. Easy, normal, routine. But excessive or prolonged NSAID use can reduce blood flow to the kidneys and increase the risk of kidney injury over time, especially in older adults, people with high blood pressure, people with diabetes, or individuals already experiencing early kidney dysfunction without knowing it. This creates a dangerous psychological trap, because the very pain many people are trying to manage may coexist alongside worsening kidney stress. There was a delivery driver in Texas who spent years taking ibuprofen almost every day, long hours driving, heavy lifting, constant back pain. The medication helped him keep working, so he never questioned it. Over time, he began feeling increasingly fatigued. Then came swelling in his feet, nighttime urination, shortness of breath. Eventually, blood tests revealed significant kidney impairment. When doctors reviewed his history, chronic NSAID overuse appeared to be one contributing factor among several others. He later admitted something heartbreaking. "I thought because I could buy it at any store, it had to be safe." And that assumption is incredibly common. Over-the-counter availability creates a false sense of harmlessness. But all medications carry risks when used excessively or improperly, especially over many years. This does not mean occasional NSAID use automatically destroys kidneys, but chronic overuse, particularly in high-risk individuals, deserves serious attention. Again, the danger often comes from accumulation. Small injuries repeated over time. That pattern appears everywhere in chronic kidney disease. Small blood pressure elevations, small blood sugar spikes, small dehydration episodes, small inflammatory stresses, small dietary excesses, tiny injuries accumulating quietly across decades, and modern food culture may be accelerating that damage dramatically. Ultra-processed foods dominate enormous portions of the American diet, loaded with sodium, added sugars, preservatives, artificial ingredients, highly refined carbohydrates. These foods create constant metabolic stress. Excess sodium raises blood pressure and fluid retention. Excess sugar contributes to obesity and diabetes. Chronic overconsumption overwhelms systems the kidneys must constantly regulate. Meanwhile, convenience culture encourages habits that silently strain the body further. Fast food during commutes, late-night processed snacks, sugary beverages replacing water, huge restaurant portions normalized as everyday eating. Again, the kidneys absorb the consequences silently, day after day, year after year. This is why chronic kidney disease often feels emotionally cruel once people finally understand what happened. Because many patients realize the damage develops slowly through ordinary routines they never viewed as dangerous. Ordinary meals, ordinary stress, ordinary medications, ordinary exhaustion. Many people slowly damage their kidneys through ordinary daily habits, not because they are careless, not because they are weak, but because modern lifestyles quietly normalize behaviors that place enormous long-term strain on the body. And kidney disease thrives inside normalization. The normalization of fatigue, the normalization of processed food, the normalization of chronic stress, the normalization of poor sleep, the normalization of daily medication dependence, the normalization of ignoring symptoms. But there is important hope inside this conversation too. Because unlike some illnesses that appear suddenly and aggressively, chronic kidney disease often progresses slowly. That means there is still time. Time to recognize symptoms, time to change habits, time to reduce damage, time to protect what kidney function still remains. And the next question becomes incredibly important. What can people actually do right now to help protect their kidneys before it is too late? The frightening truth about chronic kidney disease is that many people do not realize damage is happening until the kidneys are already struggling badly. But the hopeful truth is this: kidney disease often develops slowly, and that means small changes made consistently can have enormous long-term impact, because the kidneys are remarkably resilient organs. Even after years of stress, they often continue fighting quietly to keep the body alive and balanced. The question is whether people recognize the warning signs early enough to finally help them. And protecting kidney health does not usually begin with extreme solutions. It begins with ordinary daily decisions repeated over time. One of the simplest and most overlooked is hydration. Water plays a critical role in kidney function. The kidneys depend on healthy blood flow and adequate fluid levels to filter waste efficiently. When the body becomes chronically dehydrated, the filtration system experiences additional strain. Toxins become more concentrated, blood flow may decrease. The kidneys must work harder under less favorable conditions, and modern lifestyles make dehydration surprisingly common. Many people wake up already dehydrated, then consume coffee, energy drinks, soda, alcohol later at night. Meanwhile, actual water intake remains low. The body adapts for a while, but adaptation is not the same as optimal health. Hydration does not need to become obsessive, but it does need to become intentional. Steady water intake throughout the day helps support circulation, temperature regulation, and kidney filtration. Especially for people living in hot climates, exercising regularly, or consuming high-sodium diets. And balance matters. Drinking enormous amounts of water all at once is not the goal. Consistency matters more. Giving the body a stable environment instead of constant extremes. Exercise matters too. Not because everyone needs a perfect body, not because fitness culture demands it, but because movement improves nearly every major risk factor connected to kidney disease. Exercise helps regulate blood pressure, improves blood sugar control, supports healthy circulation, reduces inflammation, improves sleep, helps maintain healthier body weight. Even moderate activity creates meaningful benefits over time. Walking, swimming, cycling, light strength training, stretching. Consistency matters far more than perfection. And for many Americans trapped inside sedentary lifestyles, even small increases in daily movement can begin improving metabolic health dramatically. The body was designed to move, yet modern life often encourages the opposite. Hours sitting at desks, hours driving, hours staring at screens. Movement becomes optional instead of natural. And over time, physical inactivity quietly increases the risk of obesity, diabetes, hypertension, poor sleep, and cardiovascular disease, all of which place additional strain on the kidneys. Weight control becomes important for the same reason, not because of appearance, because excess body weight changes the body's internal chemistry. Blood pressure rises, inflammation increases, insulin resistance worsens. The kidneys must filter larger metabolic loads constantly. Again, the stress accumulates slowly over years. And for many people, even modest weight reduction can significantly improve blood pressure, blood sugar control, and overall kidney risk. Blood pressure management may be one of the most important protective strategies of all, because hypertension damages kidney blood vessels silently. Many people feel completely normal while blood pressure remains dangerously elevated. That is why regular monitoring matters, especially after age 40. Ignoring hypertension because symptoms are absent can become incredibly dangerous over time. The same is true for blood sugar. Poor glucose control slowly damages blood vessels throughout the body, including the kidneys. People often think diabetes only affects weight or energy levels. But high blood sugar may quietly injure the kidneys for years before obvious symptoms appear. That is why prevention matters long before crisis arrives. And nutrition plays a massive role in all of this. Modern processed food culture creates constant metabolic stress. Excess sodium, excess sugar, ultra-processed ingredients, massive portion sizes. The kidneys absorb the burden silently. Meanwhile, whole foods often support healthier metabolic balance naturally. Vegetables, fiber-rich foods, beans, whole grains, fresh fruits in appropriate amounts, lean protein sources, healthier fats. These foods help stabilize blood sugar, reduce inflammation, improve cardiovascular health, and decrease excessive sodium intake. Especially important is reducing highly processed foods whenever possible. Packaged meals, fast food, processed meats, salty snacks, frozen convenience foods. Many Americans consume sodium levels far beyond what the body truly needs, and the kidneys must constantly compensate for that overload. Again, kidney disease rarely develops from one unhealthy meal. It develops from patterns repeated for years, small habits accumulating slowly. That means improvement also happens through accumulation, one better choice repeated consistently over time. There is also another factor people underestimate constantly: sleep. Poor sleep affects nearly every major system involved in kidney health. Blood pressure regulation, hormonal balance, inflammation, blood sugar control, appetite regulation, cardiovascular stress. Chronic sleep deprivation creates biological strain the body cannot fully escape. And millions of Americans operate in a state of constant exhaustion, late-night screen exposure, stress, shift work, sleep apnea, poor sleep hygiene. The body absorbs all of it. Improving sleep quality is not laziness, it is biological maintenance. The kidneys function inside an interconnected system. When sleep deteriorates, the entire system becomes more vulnerable. Alcohol reduction matters too. Occasional drinking may not destroy kidney health for most people, but chronic heavy alcohol use increases dehydration, raises blood pressure, disrupts sleep, worsens inflammation, and places additional strain on multiple organs simultaneously. And smoking cessation may be one of the most powerful long-term investments someone can make for overall health. Smoking damages blood vessels throughout the body. The kidneys depend heavily on healthy circulation. Every cigarette contributes to vascular stress. And although quitting smoking is incredibly difficult for many people, the body often begins repairing itself surprisingly quickly after cessation. Then comes one of the most important protective tools of all: medical testing. Because early kidney disease frequently produces few obvious symptoms, simple screening may detect problems long before major damage occurs. Annual blood work, urine testing, kidney function screening, blood pressure monitoring, especially for people over age 40, or anyone with diabetes, hypertension, obesity, family history, or long-term medication use. A simple urine test may reveal protein leakage years before severe symptoms develop. A blood test may reveal declining kidney filtration before someone ever feels seriously ill. That early detection can change lives, because once severe kidney damage develops, treatment options become far more limited. There was a man in Florida who only discovered early kidney dysfunction because his employer required annual health screenings. He felt mostly fine, a little tired, a little overweight, but otherwise functional. The testing revealed elevated blood pressure, early diabetes, and declining kidney filtration. That discovery frightened him enough to make major lifestyle changes: weight loss, exercise, better nutrition, blood pressure management, reduced alcohol intake. Years later, his kidney function remained stable. Not perfect, but stable. And his doctor told him something powerful: "We caught it while your body still had time." That may be one of the most important messages in this entire conversation tonight. Time matters, awareness matters, early action matters, because your kidneys are remarkably resilient if you give them a chance. Even after years of stress, the body often fights desperately to recover when conditions improve. But recovery becomes far more difficult once severe damage takes hold. And that leads to one final truth many people ignore until it is too late. The body almost always whispers before it screams. There is something unsettling about diseases that arrive quietly. No dramatic warning, no sudden collapse, no unmistakable moment where the body announces that something is terribly wrong. Instead, the damage accumulates silently, day after day, year after year. And by the time many people finally realize what has been happening inside them, the disease has already taken far more than they ever imagined. That is what makes chronic kidney disease so dangerous. Not just the physical damage, but the silence. Tonight, we have walked through symptoms millions of people experience every day: fatigue, poor sleep, swelling, frequent urination, foamy urine, shortness of breath, muscle cramps, back pain, symptoms so common that many people automatically dismiss them. Stress, age, work, parenting, lack of sleep, getting older. And sometimes those explanations are true, but sometimes the body is trying to send warnings long before disaster arrives. That is the terrifying reality of kidney disease. It often whispers, very softly, long before it screams. And perhaps the most frightening part of all is how adaptable human beings become. People normalize exhaustion, normalize pain, normalize poor sleep, normalize swelling, normalize surviving instead of truly feeling healthy. Modern life almost encourages it. Push through, keep working, drink more caffeine, ignore the symptoms, handle it later. But the kidneys do not forget. The body keeps score silently. Every meal, every sleepless night, every uncontrolled blood pressure spike, every year of unmanaged diabetes, every cigarette, every period of chronic dehydration, every moment the body struggles to maintain balance under increasing pressure. And still, the kidneys continue working, quietly, faithfully, filtering blood every minute of every day, trying to protect the body even while damage slowly accumulates. There is something deeply emotional about realizing how hard the human body fights to keep us alive, even under terrible conditions, especially the kidneys. Many people lose enormous amounts of kidney function before symptoms become unmistakably severe, which means the body often gives people years of opportunity before complete crisis arrives. Years. That matters, because it means there is still hope in awareness, still hope in action, still hope in catching problems early. There may be someone listening tonight who recognizes themselves in these symptoms for the very first time. The nighttime urination, the swelling, the fatigue that never fully disappears, the shortness of breath, the strange itching, the constant exhaustion despite sleeping, and maybe part of the mind is already trying to dismiss it. It's probably nothing. Maybe, but maybe not. And that uncertainty alone is enough reason to pay attention. Not panic, not fear. Attention. Because one simple test could reveal problems early enough to change the future entirely. A urine test, blood work, blood pressure screening, kidney function testing, simple things, ordinary things. But sometimes ordinary tests prevent extraordinary suffering later. There was a woman in California whose father ignored symptoms for years. Fatigue, swelling, poor sleep, frequent urination. He kept delaying medical visits because he hated doctors and insisted he felt mostly fine. By the time he finally agreed to testing, he needed dialysis within months. She later said something heartbreaking. He spent years pretending nothing was wrong because he was afraid of what they might find. That fear is incredibly human. Many people avoid testing because they fear bad news. But avoiding information does not stop disease from progressing. It only removes the chance to intervene earlier, and early intervention changes lives, sometimes dramatically. Lifestyle improvements, better blood pressure control, blood sugar management, healthier nutrition, reduced sodium intake, exercise, hydration, smoking cessation, better sleep, small changes repeated consistently over time. The body often responds more powerfully than people realize, especially when action begins before severe damage develops. Because your kidneys are not asking for perfection, they are asking for support, for awareness, for a chance. And perhaps tonight's most important message is not about fear at all. It is about listening. Listening before symptoms become impossible to ignore. Listening before exhaustion becomes collapse. Listening before swelling becomes hospitalization. Listening before dialysis machines enter the story. Because once life reaches that point, everything changes. Schedules revolve around treatment. Energy disappears. Freedom changes. Food restrictions increase. Physical strength weakens. Many dialysis patients describe feeling as though life becomes divided into two chapters, before dialysis and after. And countless patients say the same painful sentence when looking backward. I wish I had known sooner. That sentence echoes through hospitals and dialysis centers across America every day. Not because kidney disease is always preventable. Sometimes genetics, autoimmune disease, infections, or unavoidable medical conditions play major roles. But many cases progress silently for years while opportunities for earlier action still exist. And awareness creates possibility. Tonight was never about turning every symptom into panic. It was about understanding patterns, recognizing when the body may need attention instead of dismissal. Because modern culture teaches people to disconnect from their own bodies, ignore discomfort, push through fatigue, accept poor sleep, normalize unhealthy habits. But the body communicates constantly. The question is whether people are listening closely enough to hear it. The body whispers before it screams. And those whispers may sound like, I'm tired all the time. My ankles keep swelling. I wake up constantly at night. My urine looks strange. I can't catch my breath. My body just doesn't feel right anymore. Sometimes those whispers are harmless. Sometimes they are not. But they deserve attention, especially after age 40. Especially for people with diabetes, high blood pressure, obesity, or family history of kidney disease. Especially for those relying heavily on painkillers, processed food, alcohol, or cigarettes, while assuming the body will somehow absorb endless stress forever. Because eventually, every system reaches a limit, and prevention is always easier than rescue. So if tonight's conversation stayed with you, do not ignore that feeling. Schedule the checkup, ask the questions, get the blood work, pay attention to the symptoms you have been rationalizing away. And maybe most importantly, talk to the people you love, parents, grandparents, spouses, friends, the people who constantly say they are fine while their bodies quietly struggle underneath. Share this conversation with them because many people do not discover kidney disease until it is dangerously advanced. And one conversation could genuinely help someone seek care earlier. If this episode helped you think differently about your health, consider subscribing and following the channel for future conversations about the hidden warning signs the body often sends long before serious disease develops. And if someone came to mind while listening tonight, send this episode to them, especially older parents who dismiss symptoms as just aging. Sometimes awareness arrives through simple conversations, and sometimes those conversations change lives, because one small test today could prevent years of suffering tomorrow.